Hi everyone, Dr. Rich Castellano here, the Smile Doctor. We're here with Victoria. Thank you, Victoria, for letting us share your treatment. We're doing an upper eyelid procedure for Victoria, and we did a little bit of facial filler for her as well, and here are her pictures. Victoria, how are you feeling?
Good.
Okay. Do you feel that relaxing medicine settling in?
Oh, yeah.
Okay, good. I feel pretty relaxed too. And so, upper eyes, we're going to trim that eyelid skin. Okay, we did a little filler for under the eyes in through here. And she did very well with that. So she's got the relaxing medicine. Nina has everything set up perfectly. So what I'm going to do now, I'm just going to adjust this so that you can see the treatment here. Now, Victoria, are you going to watch your own procedure? No, you're not. That's okay. You don't have to watch it. I'm going to do all the watching for you, okay?
Okay, perfect.
We got that part covered, yeah. And so I like to do the one stitch technique because patients, you don't necessarily need to remove muscle and fat for these eyelid procedures. That creates more recovery and it creates more bruising and swelling and discomfort. So with the one stitch technique, that allows me to make sure we get a good removal of the skin, looks natural, and you don't want to hollow the area out. You don't want to take away too much because aging takes away from our volume to begin with. So you don't want to have an over-aggressive surgery that does the same. So now what I like to do is I'm going to start by marking on the eyelid skin. We have our pictures. And I'll make, for the physicians and students that are watching, I will make a, go ahead and close your eyes for me, please. Just across the top of our eyelid crease, because that's where this incision is going to hide very nicely. Once I draw out the lower part, then I'll take a ruler and measure. And generally, I like to do about 15 to 20 millimeters past the most lateral-most eyelash. I'm going to go around maybe 18. And then the incision line falls right into the crease. Perfect. And same on this side. Measure twice, cut once, as they say. And connect the dots. So I use my judgment on how to measure, but this part, once you've laid out the lower incision line, now you just keep that mark perfect. So this way it's very precise. I know exactly where we're going to be treating. And I can still verify that our lower eyelid is going to close correctly. There's a word for that. If the eyelid does not close afterwards, it's called lagophthalmos. And that's lagos, the Latin word root for rabbit, because rabbits look like they never close their eyes. And so we obviously want to avoid that. And better to come back another day and do more rather than go too far. Everything's looking good. Perfect. She's going to see a nice improvement here. I'm just going to pinch a little bit over here just to verify. Good. Okay. So once we've drawn out the incisions, and open your eyes for me, and when she opens I can see the lateralmost portion that we're going to be taking away, so that verifies what we need. And close for me, please. So pinch on 3, 1, 2, 3, pinch. You feel a big pinch, little pinch, not too bad.
Not bad.
I like to give the patients, when you're numbing under local anesthesia, let them know, give them a few options. Because if you say, did you feel that? They'll say, they'll describe something, but I want to know if they're feeling something that's not bad, that's the lower end, middle of the road, or high. So give them a few choices, and then you'll very quickly know, do you really need to slow down or give more relaxing medicine? Because if they're saying, wow, that's a really big pinch, then we need to slow down, or I need to do a different approach so that they feel comfortable. There she feels a little bit more bigger pinch, and I can see you know, when she's moving, and you might feel like a little bit of burning there.
Yeah,
That's going to
what
go
it is.
away. Yeah. And because the numbing medicine, if a tiny bit seeps into the eye, it doesn't hurt anything, but it burns temporarily and then goes away very quickly. So that's 3 cc's on the right side. Now we're going to do some numbing on this side. Yes, we're doing an eye lift. Hi, Valerie. Thanks for watching. And thank you all for sharing. If you're just now joining, little pinch. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Please do share with your friends. Let them know you're watching live procedure, because if you tell them you are watching it, and then they're going to get upset with you because you didn't share it with them, they're going to say, well, I wanted to see that. So make sure you share. All done under local anesthesia. Look us up at imagelift.com or download our book. And you had a chance to look through our book, Victoria?
Absolutely.
Was that a helpful resource?
Oh, yeah.
Okay.
Made me more at ease, yes.
Oh, good, good. And so we have our books that are on Amazon. They both hit the Wall Street Journal bestseller list. We guarantee we can make you look younger, and the Smile prescription. Everything's looking good. So now that we've done the numbing medicine, now I'm going to walk over to the other side here. And my team has done such a great job setting everything up perfectly. Makes it very easy for me. Thank you, Nina, and Charlene's here today. It's a rainy day here in Tampa. It's a great day to do an eyelid lift because it's all wet outside. Okay, local, please. Pam says, ouch. Do you feel any pain there?
Oh, no.
So you say ouch, but Victoria's not feeling any pain here.
Oh, no.
And she has a fair bit of skin. You can see that there.
Oh, yes.
But we're going to take care of that. Fine tooth. So then I use the fine tooth. Someone said, how much does that cost? If you go to imagelift.com/pricing, you'll see the cost. Let me turn your head a little bit this way. Perfect. And you can give us a call, 813-463-9245. Happy to give you any information you request, and turn your head a little bit more that way. Thank you. Perfect. Everything's looking good. So I'm just going down to the level of the orbicularis oculi, that's the muscle. And then I'll use a tenotomy, which is a very small scissors, to trim the eyelid skin. Some people do this with the monopolar cautery, but I think this is the least traumatic and least heat. There's no heat injury with something like this, so that's just trimming the skin. And you see right below is the muscle layer. We don't need to take fatty pocket out because you don't want to hollow the eyes out prematurely. And then I'll do a little bit of bipolar cautery to make sure all the blood vessels are cauterized. Everything's looking good. Thanks for watching. Please do share. For our patients who speak Spanish, yo hablo un poquito español. Mi oficina hablar español muy bueno, y por favor llamar la clínica 813-463-9245. Y yo tener muchos pacientes hablas español. And for the physicians and students that are watching, make sure you take a look at our, you feel a little pinch there?
Just a little pressure.
How about here? Any pinching or anything like that?
No.
For the physicians and students that are watching, make sure you check out our website, practiceprofitabilitymd.com. Hasta luego. The cicatrix es muy pequeño y no puedo mirar fácil. Es al dentro de ruga de arriba de ojo. So there was this question in Spanish about, is the scar easy to see? Very difficult to see, and it hides very nicely in the skin crease. So for the physicians and students that are watching, we'll be at the Tampa Convention Center October 18, 19, 20. Give us a call. Check out our website, Practice Profitability MD. Come get your CME credit. Everything's looking good.
Oh, good.
Okay, I'm going to turn your head this way just a little bit. So this is the 5-O-Proline, and what I do here is just a running subcuticular suture. Perfect. Everything's looking good. I'll normally see patients at 1 week, but if they need me before then, they can come to the office at any time. I used to do sutures when I was in my training where you do multiple little stitches and throw multiple knots, and those sometimes can be visible. This is a much far superior technique now because you feel a little pinch there?
Mm-hmm.
How about now? You feel a little, so I'm going to do a little bit of numbing medicine.
Okay.
So you feel a little, do you feel a little bit of pinching there?
Nope.
You might feel some pulling and pressure, that's
Yeah,
for sure.
that's what I feel.
Yeah, you'll feel pulling and pressure, but you shouldn't feel so much pinching. Very good. Thank you for watching. Thank you for sharing. We will have more videos later, so make sure you get the alerts so you don't miss out. Patients really want to know what their options are. And so we love doing the videos so that people can see firsthand. Here's what we do. Thank you. Yes. Thank you. And clonidine. Have that around.
Got it.
Thank you.
You're welcome.
Everything's looking good. Are you feeling any discomfort at all, Victoria?
Oh, no.
Okay, very good. So sometimes I'll take these stitches out at a week. Sometimes I'll give them a couple of weeks for it to do their thing.
I'm surprised that I'm able to, that I'm awake and everything while you're doing it.
Yeah, we keep it that simple.
Mm-hmm.
You get the hang of it after a few thousand. This is how we do it.
Listen, I need to have this done, although I'm very squeamish about eyes.
Yeah, even if you're squeamish about eyes, you're going to do so well because you can't tell what's going on.
No.
You just close your eyes. That's all you have to do.
Yep, that's what I'm doing.
Even if you are squeamish, it's not a big deal because you'll be done before you know it. And you just can't tell. So even if you're squeamish, this is a perfect technique for you. Way better than having general anesthesia.
Oh, yes.
Very good. Thank you for watching. Thank you for sharing. So then I very delicately just draw this suture through. Perfect. And I'll do a little knot, and I will trim this knot when we take the stitch out, and then we slide it all the way through. You can take that, please.
Mm-hmm.
Cut, please. I'm all set here. Can you just make sure that Charlene
They're
is...
good to go. Cool.
And if you get your gloves off, can you just tap that seam and see what it is?
Sure.
Yeah, someone mentioned about sometimes the doctor may stitch the eyelid shut during the procedure. That's not necessary for what we're doing, as you can see. Open your eyes for me. Right, how many fingers here?
2,
How about over here?
3.
So your eyes are open, you can see, so very good. Now I'm going to go over to the other side. Everything's looking good. And the blood pressure, let me know the blood pressure.
Okay.
So we'll be done here in just a little bit. Thank you for watching. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Please do share. Let your family and friends know that we're doing live procedures. Patients want to look their best. None of our physical features compare with our personality. The personality always outshines everything else. But if you want to look younger and a little refreshed, well, we can help you with that. So now, I'm going to turn your head this way a little bit, Victoria. That's
Yes.
perfect. And 15 blade. Now, Victoria will feel like her right eye is a little more difficult to close, and that's normal because of the swelling. There's a little swelling from the numbing medicine, swelling from the procedure, and of course that's all going to go away. So I make the inferior incision, now the superior incision. We've already marked out the lines, and this way you get a nice, continuous, even incision that makes it very easy to stitch back together and hide the ultimate scar right in the eyelid crease, and it's just very difficult to see that once it heals up. Okay, everything's looking good. Thank you for watching. Thank you for sharing. Look us up at imagelift.com. Look up our books on Amazon if you have questions. We're in Tampa and in the Villages, Florida. We just had a wonderful seminar out at Sun City Center, and big turnout and a lot of fun. Our events are always a lot of fun. Go to imagelift.com/events. If you want to learn more, we have Caitlin, who is our nurse injector out in the Villages, and she has some specials for her fillers, and she's a great injector, so we're excited to have her as a part of our team. Perfect. Very good. Are you feeling any pain at all, Victoria?
Oh no, I smell something.
She smells a little bit of the cautery.
Yeah, I would let you know if I was feeling pain.
Yeah,
I don't.
You don't have to be a hero.
Nope.
Patients tell me that. They say, I'll tell you if I'm feeling pain.
Yes.
But the goal is that you don't really feel any pain at all during the procedure. And if you feel a pinch, I'll give you some numbing medicine, and then it's over very quickly.
Seems like a quick procedure.
Oh, yes. So now the running subcuticular suture. So I like to tell patients to apply the ointment, the lubricant, the mineral oil, Vaseline lubricant called Lacrolube or Refresh Tears. You want to stay shiny. If it looks dry, you reapply. And so you can resume your physical activities, but just listen to your body. No rubbing and scrubbing on the eyes. You can get wet the next day, but don't soak. Everything's looking good. Perfect. So you can see the edges of the incision, they just close up like a little zipper or like a seal. And before you know it, we've closed the entire incision just with one stitch. It's such an elegant way to do things, and this way you don't have the need for multiple stitches, multiple suture removal. It's just one stitch that's got to come out. And you leave the muscle, you leave the fat, because you don't want to create the need for additional healing. You don't want to create the need for additional discomfort. Perfect. See, everything comes together very nicely. So I do the little knot here. And suture scissors. So you did great. You are done. That wasn't too bad, was it?
Wow, no.
Thank you for being such a great patient. We didn't have to give you any warnings or anything like that. I'm just kidding. We don't give warnings. Everybody does a great job. And so we're very proud of Victoria. Give us a call if you have any questions. ImageLift 813-463-9245. Open your eyes for me. How many
All right.
fingers here?
2,
How about over here?
3.
So you see how simple it can be. And just one more time, let me show you how her upper eyes had that extra eyelid skin, and now we've trimmed all that extra away, so she's swollen. As I say, you don't want to taste the chocolate cake before it's done baking. She's not ready yet. So congratulations, you did great, and thank you everyone for watching.
Thank
We'll
you.
see you all in the next video. Bye. All right, very good.